This is the part of the program where we put your COVID-19 questions directly to the medical experts. But tonight, those questions are coming from kids. Now, here to answer those questions, we have Dr. Isaac Bogosh, an infectious diseases specialist, and pediatrician Dr. Dina Kulik. So here we go. First question. This is for you, Dr. Kulik, and it's from Parker.
My questions about the virus is, how long does it stay in your body and what does it do to your body?
Go for it.
That's an excellent question. So COVID probably lives in your body for about 2 weeks. Some studies show even up to 3 or 4 weeks, but most of us are thinking about 14 days. And what happens is when the virus enters your body, typically that's from your eyes or your nose or your mouth, from you touching a surface that had COVID on it. And once it goes into your body, it starts to make different versions of itself. So it starts to replicate, making more and more and more of COVID copies. And that's why people start to get symptoms, because they have more of these copies in their nose and in their throat and sometimes going down into their chest. And that will cause the cough and runny nose and fever that some people get with COVID.
And when does it, or how does it leave the body eventually?
Well, eventually your body's immune system will start to fight that virus like it does any virus like influenza or others. Your body will start to recognize it as being foreign and start to attack it. And when it attacks it, that's when you start to get better and less contagious.
All right. Dr. Bogosh, this next question is for you, and it's from Olivia.
I was wondering, what does it feel like to have the virus?
Oh, Olivia, that's a good question. We know that many people that have this virus are going to feel pretty crummy for a few days. They might have a fever, they might have a cough, they might feel pretty run down and have to stay at home and stay on the couch or stay in bed for a few days. But luckily, most people that get this infection will start to feel better after a few days, and most people won't even need to go to the hospital for care. So most people will do just fine, and they'll get better on their own after a few days at home.
Okay, Dr. Bogosh, we've got another one for you. This is from Sequoia.
When will they find a cure for COVID-19?
Oh, Sequoia, that's also a great question. So, there's lots of doctors and scientists working on finding a cure. There's studies that are going on right now, and they're testing lots of new drugs. So hopefully we're going to have some answers in the next 2 to 3 months about new drugs that can be used to treat this. And then just like people get vaccines once a year for the flu, they're working on getting a vaccine for COVID-19. And that's probably about a year to a year and a half away still. So the treatments we'll know a bit more about in the next 2 to 3 months, but a vaccine probably close to a year or a year and a half.
Yeah, does any medicine help?
So certainly right now we know that there isn't any specific medicine that we can use that will help fight this infection. But there's lots of different drugs that we're trying to see if they'll work, and we'll have an answer pretty soon.
Okay. Dr. Kulik, this next question is from Quentin.
My question is, my mom is not sick, my dad's not sick, and my brother's not sick. Why do we have to stay home?
It's an excellent question. The reason is 2 things. One, we want to make sure that you and your family stay healthy. And if you're out in the world and going to school, or your parents are going to work, or you're going to the playground, you might get infection. And that means you might bring it home to your family and people may get sick. But also, you could actually have the infection, or someone in your family could, and you may not know it. Because lots of people that have COVID have no symptoms or very mild symptoms. So by you staying home, you're protecting yourself from getting it from other people, and you're protecting other people from getting it from you, even if you're not sick.
Right. Best to be careful. Dr. Bogosh, this is Alexandra.
My question is, can you catch COVID-19 multiple times?
Alexandra, that's a fantastic question. And, the short answer is we're not 100% sure just yet. But most people who are in science and medicine and public health think that once you get this infection and you recover from it, you're not going to be able to get it again, at least for the next few months to probably a year. So once you get it and recover, you're very likely to be okay and not going to get it again.
Okay, we've got a little bit of time left. Dr. Kulik, this is Ella.
I would like to know, how can I help other people from not getting COVID-19?
Fantastic question. So the way we prevent the infection is 2 things. One is maintaining physical or social distance. So that's why you guys are not in school, and that's why many of us are not working, and we're not going to the playground or grocery stores and trying to stay away. if you stay at least 2 meters away from other people, you're less likely to get it from them. But then the other piece is to maintain really, really clean hands. So you want to be washing for at least 20 to 30 seconds with soap and water multiple times per day. Because the most common reason why we get COVID is by touching other surfaces that have the virus on it, and then touching our eyes or our nose or our mouths, and then the virus can enter our body. So keeping good, clean hands and staying away from other people.
Okay, Dr. Kulik, Dr. Bogosh, and all the kids who sent in questions, thank you so much for your time. Really appreciate it.